Good afternoon. This is Kim Clater. I'm the Compliance Director with NTA Incorporated, and appreciate you guys joining us this afternoon for our webinar on medical marijuana, CBD oil, and hopefully this will be helpful to you guys in terms of what employers need to know. And this is a fairly brief webinar this afternoon, but what we will share with you would be some basic information on CBD oil, the current status of medical marijuana, the basic info, the questions that we get on a very regular basis, what you need to know in terms of the legal aspects of that, what the employer needs to consider, and then just some basic myths, some common myths that we run into on a regular basis. We want to talk to you a little bit about basic aspects on marijuana, things that you do need to consider, and we will go ahead and move forward from here. Marijuana. Most of you, I'm sure, have had this on your drug test for quite some time. You have common names. You have weed, blunts, herb, Mary Jane, grass, dope, reefer, pot dope. The bottom line is this has been around for a long time. It's been the subject of much controversy. And you have proponents, they tout the medical benefits, and then you have some that assert that recreational use is safe. What we have seen over the years, this drug is really, it's like any drug. It has some uses that can be medicinal, but with any drug, it does have side effects. It does not come without some things of concern, and as employers, you do need to be aware of that. You have opponents of legalized marijuana. They offer evidence from numerous studies. Anything that, again, that you're going to take that would be a pharmaceutical, anything up to a supplement is going to have possible adverse effects. You can have physical, you can have psychological effects on your health and safety. So let's take a look at some common myths and some common facts about marijuana to get this started. And then number one, we want to look at you cannot get addicted to marijuana. That's the first thing that we hear. The studies show from the U.S. National Institute on Drug Abuse, I think most of you would know that as NIDA, that 30% of users can develop a level of dependence to marijuana. So in other words, you can become addicted. Once you have a dependence or a tolerance of the drug, the user has to take more of the drug to maintain the same level of high that they're looking for. Marijuana, like other drugs, alters the brain's chemistry, which is a hallmark of addiction. So again, we do hear often you cannot become addicted. The studies support that you definitely can. Number two, there is no such thing as marijuana withdrawal. You do have marijuana withdrawal symptoms. We do see commonly when we do talk with the substance abuse professionals in the treatment world that do deal with addicts on a regular basis. You know, those that deal with heavy users from drugs such as cocaine, methamphetamines, often they report that there are cross addictions with marijuana. You can have withdrawal symptoms. So with any drug, when that addiction has been established, you're going to have these symptoms, especially with heavy users. Typical marijuana withdrawal symptoms, you're going to have cravings, decreased appetite, irritability, difficulty sleeping, restlessness, agitation, weight loss. They typically last about 2 weeks with marijuana withdrawal. These are things that you could see possibly in the employee. So again, they do have withdrawal symptoms. Number three, we hear often, well, it would be safer to smoke marijuana and drive than to drive under the influence of alcohol. Again, driving or operating equipment under the influence of any substance, any drug, is dangerous. Marijuana carries added risks, altered depth perception, distorted sense of time passage, risk of cardiovascular events due to increased blood pressure, heart rate, decreased alertness, reaction times, coordination are common side effects. most people are not aware that the part of the brain that marijuana affects has a very significant effect on your sense of time passage and depth perception. So, in other words, if you are operating a vehicle, you're moving down the road at an actual speed of 45 miles per hour, you would feel that you are going much faster. So that could have a very significant impact on the operation of equipment. It could have an impact on your reaction times. You cannot compensate for the way that marijuana impacts the brain. So again, neither one of these are safe, but there is a common misperception out there that, you can smoke marijuana, it's going to be safe to operate a vehicle, whereas it's not, obviously people know you can't drive under the influence of alcohol, but people think that you can with marijuana. It is not safe. Another myth. Number 4, a lot of people are not aware that smoking marijuana does increase your cancer risk significantly. The studies have shown, this does quote the British Lung Foundation, we do have American studies that do support and actually do indicate that due to the tar content, marijuana joints have actually a 50% higher carcinogen rate than tobacco cigarettes. It also increases elevated pulse rates, heart rates, sore throats, asthma, bronchitis, COPD. So you have a whole host of health issues that come along with smoking marijuana on a regular basis. But again, the general public is not aware that it does have a higher carcinogen rate. Number 5, there is a common myth that it's easy to spot cannabis users. It is not true. Most people have this stereotype in their mind. They think that people that smoke pot, they kind of have a cartoonish type idea in their mind, such as Scooby-Doo Shaggy, Cheech and Chong. In other words, it pretty much cuts across all socioeconomic boundaries now. It is very well accepted. You have users that are professional down to the construction workers. So it's pretty much, it cuts across state, all socioeconomic boundaries. So the basic signs of what you're going to see would be inflammation in the whites of the eyes, diminished motor skills and speech, inappropriate laughter, and again, distorted sense of time passage and depth perception. You would have a person that seems to be moving in a very altered or very slow manner. They seem to be almost like they are in a very altered state of reality, or they seem to be moving extremely slowly. Those are the very common things that you would see. There is a common myth it's the best treatment for glaucoma. It would have to be smoked 6 to 8 times a day to provide any consistent effect. So that is a myth. As a result, the American Academy of Ophthalmology does not endorse it as a primary treatment for glaucoma. It is not to say that it cannot be used, but the effects of that much THC in the system would create significant impairment. Number 7, there are no long-term effects on mental health from smoking marijuana. Study after study concludes that marijuana works on the brain the same way that alcohol, cocaine, and heroin do. Once ingested, THC binds to the receptors in the brain. It remains there, affecting concentration, time perception, memory, thought processes. Mental disorders such as panic attacks, schizophrenia, depression are common among marijuana addicts. Verbal memory is impacted among marijuana addicts. You have short-term memory issues. That's very, very common. So if you have someone that has been a heavy marijuana user for a number of years, you are going to have long-term effects. So again, it is not a harmless drug. Medical marijuana, recreational use of marijuana, is going to have long-term effects. Employers need to keep this in mind. Number 8, there is a common myth that there have been no deaths directly attributed to marijuana. Marijuana advocates tout that it is difficult to attribute deaths solely to the use of THC versus other drugs of abuse. However, researchers have determined that numerous deaths can be directly attributed to the use of marijuana. THC is well known to affect the cardiovascular system, elevating blood pressure and heart rate. These deaths are often directly linked to fatal arrhythmia. In addition, fatal accidents can be linked to marijuana use. So again, we have study after study that does link marijuana use directly to fatal accidents and fatal medical events. Number 9, it is a myth. Synthetic marijuana is safer than natural marijuana. I won't spend a lot of time on this. This has decreased in popularity. It is still used. We still do see this in the workplace and in the general population. It's a little harder to get than it was several years ago, but it is not safer. That it cannot be detected on a general drug test. There is a specific test for it. However, it is not safer. It is not uncommon to find rat poison, fertilizer, or it can be cut with synthetic. Synthetic THC can be cut with substances such as fentanyl. So again, it is not a safer alternative. So that is a myth. And then finally, number 10, common myth, by drinking enough water you can flush out marijuana. That is a common myth. It absolutely does not flush out the THC. It just simply dilutes the specimen. In addition, drinking too much water can cause water intoxication. So these are some very common myths the employer needs to be aware of. Now, some facts. The active ingredient is THC. That is, you have in the cannabis plant, you're going to have THC and you're going to have CBD, which we'll get to momentarily. So you have THC. The appearance often resembles crushed oregano or tobacco. It can be green, gray, brown in color. It can be smoked in a pipe, cigarette, blunt, or vaporizer. It can be consumed in tea or food. You can put a few drops of oil on a tobacco cigarette. It can be smoked. Higher quality marijuana is made only from the flowering bud. Lower quality may use the stems, leaves, and seeds. So why do people use marijuana? It is used because the primary active ingredient, THC, so let's remember this term, THC, this is really important. This is the ingredient that is actually tested for on your typical drug screen. This is what is looked for. Produces a relaxed state. It heightens the senses. THC causes a dopamine release. Dopamine is a chemical in the body that causes euphoria and pleasure. So when people are using marijuana recreationally, that's what they're looking for. They're looking for that dopamine release, looking for that euphoria and pleasure sensation. So when smoked, the effects are felt as soon as THC enters the bloodstream. It lasts 1 to 3 hours. If ingested, the effects are felt within 30 minutes, up to an hour, and will last up to 4 hours. So it just depends on the method of delivery. So that is why people tend to use that recreationally. Risks. So these are some very significant risks. This was mentioned before, so let's elaborate a little bit more on this. Increased heart rate, blood pressure. Most people do not realize that THC is a dilator. It dilates and flushes blood vessels. That means it opens them up, it enlarges the blood vessels, the capillaries throughout the body. Therefore, it can raise heart rate, it can increase blood pressure. It enlarges the bronchial passages. Again, it causes cardiovascular damage from these dilated vessels. Increased susceptibility to lung infections. Increased risk of lung cancer because it has that 50% higher carcinogen rate. Increased risk of COPD, impaired memory, increased risk of mental disorders with regular use. So again, these are all risks of marijuana use. The employer needs to keep this in mind when considering, are we going to continue testing for marijuana as part of our program as the medical marijuana trend has advanced and it's coming across, and employers are taking a look at this, which we will come to momentarily. Finally, you want to look at these findings. The Insurance Institute for Highway Safety has published findings that accidents in states that have legalized marijuana are up 6% over the states that have not legalized marijuana. The Highway Loss and Data Institute finds in the same period that police-reported crash rates are up 5.2% in states that have legalized recreational marijuana. And there is an interesting piece of data that emerged. In the states where that marijuana has been legalized, whether for medicinal purposes or recreational purposes, they found that 14% of those people that are under the influence of marijuana had children in the car with them, whereas people that are under the influence of alcohol tend not to put children in the car with them. So a very interesting piece of data did emerge with this. And again, this is all there for anyone to take a look at. So let's take a look at CBD oil versus THC. CBD, it works in a different way to THC. It does not bind with these different receptors in the brain. Its effects come from reducing the breakdown of the endocannabinoids in the body. It does not have a psychoactive effect in the body. That is why all of these CBD oil products have emerged. You get the good medical effects, supposedly. You get the pain relief, the relaxation, anti-anxiety, all of these different supposed positive medical effects without the psychoactive effects. THC, on the other hand, you have all of the supposed positive medical effects, but you're going to have the psychoactive effects. So that is the big difference between the two. It's fairly simple. The problem that arises is that basically they both come from one plant. They both come from the cannabis plant. And there is really no way to separate all of the THC, but we'll come to that momentarily. So you have the CBD oil, which is the one ingredient, and then you have the THC. They both come from the same plant. So first, we'll talk about medical marijuana. Most of the states that have legalized medical marijuana follow a format that is similar to this. And they have different terms for this, but it's similar to this. The state will have approved growers and pharmaceutical processors. So they have state-approved growers that grow the marijuana. They have processors that process it. Then they will have a process where the patients go to physicians that will determine that they meet the criteria for a medical condition that warrants the use of medical marijuana. And typically, most states do have a stipulation that the medical condition cannot be treated effectively with, typically other medications. That's usually what they do mandate. So once they meet that approval, the physician will issue this type of written certification. They will then have to register through some sort of board of pharmacy or registration process through the state. Then they can, at that point, walk into a state-approved dispensary or a store. I mean, there are different methods. Again, each state has, they have different names for them, but I will use dispensary for this purpose. They have their medical card, and they can go into the dispensary, and they can obtain the medical marijuana. So it's a very, it is a state-controlled, typically restricted process. It is not a process where people can grow this independently. So they do have to be approved. You have growers, processors, dispensaries, physicians, and some type of prescription card. So what does the employer do with this? What the employer does with this is going to depend on the conversations that take place within that you want to have before it is legalized in your state or shortly thereafter. So let's look at a few things. In most states, you want to keep in mind that it still might be illegal to purchase these products, bring it across state lines. They could come in the form of capsules, sprays, oils, gels, patches, creams, tinctures, lollipops. Some edibles, flower products might not be permitted. And again, this is some of your CBD oils and that kind of thing. It gives you some pictures here. CBD oils are psychoactive. They're non-intoxicating. CBD is not considered legal in all 50 states. It is considered by the DEA, Congress, FDA, and NIDA to be a Schedule I controlled substance under federal law. It is currently that the ones that are currently being bought online and illegally do not meet any type of safety, quality, consistency, or labeling standards. So the buyer needs to beware. Some states have reciprocity with other states, written certification, so the patient should check when traveling. These are all things you have to keep in mind. Now, this is what is really important for the employer when it comes to CBD oil. CBD oil products can and do show up on DOT and non-DOT drug screens. There is no current processing method that can entirely remove THC from the cannabis plant that is used to make the CBD oil product. Thus, when the employee tells the medical review officer or the employer that they have not used marijuana and that the positive THC drug screen is due to CBD oil, there is no way that this can be distinguished on the drug screen. So the scenario that I would put forth would be if you have a commercial driver and this commercial driver is using CBD oil on a regular basis for pain relief, and this driver has a positive for marijuana. This goes to the medical review officer. He tells the medical review officer that he is using CBD oil under federal law. Number one, USDOT says medical marijuana, CBD oil, it doesn't matter as far as they're concerned, even if there's a prescription, it is not ever going to be accepted, number one. But the medical review officer, even if it was on DOT, would not be able to ever distinguish between was it true marijuana abuse or was it the use of CBD oil. Because again, you cannot pull THC, all of the THC, out of these CBD oil products. These products typically will say there is a level of THC in the product, the product itself. It may say it's at a point, 0.5 or below, but they will still have THC in them. And if they are used on a regular basis, THC is not water soluble. It does stay in the fat cells for a period of time and can show up on these drug screens. At NTA, we do see this on a regular basis. Medical review officers at this point in time, even with non-DOT drug screens, are going to rule these tests positive. So as the employer, you do need to understand this. So what does the employer want to consider? You may not necessarily be crippled in terms of addressing marijuana use on the job. Court rulings have been varied on challenges to employer prohibitions, especially when built around ADA issues that are based on legal prescriptions or medical certifications. U.S. DOT agencies prohibit the use of marijuana in any form, so that makes it very easy and very clear-cut for the employer with that set of employees. So medical marijuana, CBD use is completely prohibited with your U.S. DOT governed employees, so that makes it easy for you. But what about the other employees? So let's talk about that. You have certain states for which you can almost certainly terminate employees for testing positive for marijuana, since the states either have no marijuana access program or because only CBD low THC products are permitted. And we have a list of those states there. So you'd want to keep that in mind if you are an employer based in any of those states. Then you want to come down and you want to take a look at this third point. Number one, employers must ensure that your written policy clearly prohibits the use of marijuana in an amount that is indicative of impairment on the job. And then you distribute the policy, you obtain a signed and dated receipt from each employee, and that is important in preventing abuse in the workplace. Because if you go right back up to the second point, the very nature of marijuana and the uncontrolled psychoactive property makes the illegal use of this drug a danger in the workplace. This goes back to what we are seeing and what is turning out to be best practice and what the court challenges pretty much are playing out in the states where marijuana has been legalized. And what we are seeing, the employers are able to write their policies that if marijuana is being used, if it is prohibited in safety-sensitive functions, if it is prohibited at levels of impairment that are pretty significant, then at that point, the employers can act, and they do still have some leeway with this with these employees. Now, it is pretty much up to the employer on the non-DOT side as to what degree you want to accept prescriptions or medical certifications. Most employers on the non-DOT side are accepting, once that's been turned over to them by the medical review officer, they are accepting when the employee comes forth with that prescription card or that medical certification card for medical marijuana or CBD oil. So that is something that you would want to keep in mind, and those are things that is how you're going to want to write your policy. Again, NTA will help any employer write your policy accordingly. You're going to want to make sure that these employees understand the nature of CBD oil products. They understand the state in which you are domiciled and work. In terms of medical marijuana, what those laws are in that particular state, that they understand the process where they get the medical certification or the prescription for that, and the parameters in which they can operate and the parameters in which the employer operates. And it goes back to the written policy, and it goes back to the education for the employee. So policy, education for the employee, understanding what the laws are in that state, understanding what the employer wants to do. Will you continue to test for marijuana? Some employers are dropping that from the drug screen altogether. We do not recommend that for the reasons that we covered at the very beginning of this webinar. Marijuana, again, is still a dangerous drug. It has dangerous side effects. It has significant effects on the brain and motor skills. So it is not a good idea as part of your drug-free workplace program to drop testing of marijuana from your drug test. Just understand what the medical marijuana laws are in your state and write your policy accordingly. The same thing applies for the CBD oils. Understand what these products are, understand how they show up on the drug screen, what the laws are in your state, and how that would apply and how you would want to handle that. And again, we will help you with that in terms of your particular state. Supervisory training, again, educating your supervisors on the signs and the symptoms of marijuana use. Super important. Understanding how to recognize withdrawal from marijuana. And then understanding the different drug testing provisions that you have, reasonable cause, and then understanding how the employees can get help with that. All of this plays in this medical marijuana scenario and how this is shaping up, because we now have 33 states that have embraced this, and probably eventually we will have more, and to the point that it's probably going to be pretty much nationwide. So it is important to stay current on the changes, the developments on the legalization of marijuana in your state. And if you have any questions at the end of this, we will give you an opportunity you can email me, my email address, my phone number, my extension. Please feel free to email me with any questions, any concerns about medical marijuana, how it impacts your workplace, what the laws are in your state, what you would want to do in terms of your organization. We'll be glad to help you. Thank you for joining us for our webinar today on medical marijuana and CBD oil, and we look forward to assisting you with your program. Have a great day.